Of course, the pandemic has meant that everybody has had to make some changes. And after this year's Ramadan took place in strict lockdown, Muslims around the world have begun celebrating Eid. Dr. Mehtab Rahman is a consultant psychiatrist at the male ICU mental health unit for St. Charles's Hospital, where they're having a special Eid celebration today. Doctor, good morning. Thanks for joining us. Tell us about the lunch.
Oh, hi, good morning. Thanks so much for having us on air.
It's a pleasure.
So we run a male intensive care unit. It's called Nile Ward at St. Charles Hospital. And this is a special unit within St. Charles that looks after the most unwell male patients who are suffering from psychotic disorder or a mood disorder. And they're quite unwell to the point that they're unable to be looked after in a normal psychiatric unit, in ward, I mean. And basically, because of the lockdown, obviously, our patients are not getting leave from hospital because of the risk of bringing the infection into the hospital or bringing the infection into the hospital. So basically what we're doing is we do have quite a multicultural population. We have got a lot of Muslim patients and staff. But what we're doing is we are trying to celebrate Eid, the end of Ramadan Eid within our ward today, in order to celebrate diversity, in order to put forward the values of generosity and compassion that Eid is all about and Ramadan is all about. So what we're doing is the staff and patients, we are getting together. It's a co-production where we're all going to get together and prepare a very special meal, and we are going to celebrate together. I think it's going to be a very joyful occasion, and I think it's an absolutely great way to celebrate Eid, between ourselves.
It does sound like a fabulous idea. Could I ask you a little bit, though, Doctor, about the effect of this lockdown and global pandemic on people with a history of really severe mental illness? Because one of the things that we've found out on this program on many occasions is that if your mental health is turbulent and often ruptured, and you really have big mental health issues, one of the things that helps to soothe and calm you is structure, familiarity, normality. And there's nothing normal, and the structure's gone. And so people with mental health issues are finding things exceptionally difficult. Would you agree with that assessment?
Absolutely. I 100% agree with you. Yeah. So basically, as I mentioned, I look after some of the most unwell patients in the community.
Yes.
And what we have been noticing is that a lot of our patients are actually getting very unwell and suffering from psychotic breakdowns, particularly because the community support they have might not be as good as it was before, and they're obviously quite lonely, many of them, who are living on their own. We are seeing a lot more admissions that have been triggered directly by the lockdown, directly by, loneliness, and directly by the sense of isolation. And what you said is absolutely right. So many of our patients who are coming in, the structure in the ward, the ability to speak to people, getting the care that they need is absolutely essential for them, and the good news is that they're all making a very good recovery with the right support. And the other thing I just wanted to mention was that this celebration is actually part of a bigger project we're doing. So basically, because intensive care unit, our patients are very unwell. When they are very unwell, they can be very paranoid, and that can often manifest as being threatening and aggressive. They end up in a PQ. So, I mean, this celebration is not just about celebrating Eid, but this is actually an exercise of tolerance and understanding, which is so essential, for us to all live in harmony in the community.
I must say, to hear you say, Doctor, that your patients, those you care for, are males, they are severely mentally ill, they're psychotic, they really have got, the utmost mental health problems to deal with. And to hear you say in this very, very lovely way, and they're all making good recovery, I mean, that's an enormous thing to hang on to from what you're saying, because I think many of us have maybe imagined that if you're that ill, if you're so severely mentally ill, as you say, you can't be cared for at home, can't be cared for in other units, that you would never make a recovery. You'd always be in that kind of pitch of turmoil and misery. But you're saying that isn't the case.
No, and that's absolutely the reason why I'm so grateful to you, to your show for highlighting this, because, I would say the majority, more than 90% of our patients make a full recovery and they go back to the community. There are a few patients who might need an extra level of care. For example, they might need rehabilitation or other services and a more prolonged admission. But generally, I think one of the other things I must highlight is that, in our unit, we just don't use medications as the sole way of treating our patients, although these community activities, physical activities, art, music therapy, reading sessions, writing sessions are all part of their care plan, actually. We believe that all of it, it's a very holistic care we provide, and all of that has to come together in order to make sure that our patients are recovering to the best of their ability.
Well, I do hope you have a fantastic celebration today, and that it's really very enjoyable and enormously therapeutic, and that the message of Eid that you've expressed so beautifully on the programme gets through. And it's a pleasure talking to you. We really have enjoyed it enormously. And anytime you want to talk to us, please feel free just to get in touch with my producer, and we'll talk to you anytime about this, because as much coverage as we can possibly give mental health, we are extremely willing and pleased to do. Thank you very much, Dr. Mehtab Rahman, their consultant psychiatrist at the Male ICU Mental Health Unit for St Charles's Hospital, where they're having a celebratory Eid lunch today, and I wish them a lot of pleasure doing so. Let's talk to Linda in Bex.